My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
Hello. Thank you for your interest in the Pediatric Residency program at UECOM Peoria.
I'm the Associate Program Director for the Pediatric Residency program here in Peoria. We take 10 pediatric residents a year, and our sister program, MedPeds, takes 8 residents per year. We are a moderate-sized program in a moderate-sized town. We have all the big city amenities, but without the traffic.
Our team consists of Dr. Beekman, who is our Associate Program Director, Dr. Moinudeen, Dr. Rose, Dr. Christensen, our Assistant Program Directors, and Dr. Hansen, our Quality and Safety Champion. Our Residency Coordinator is Christy Vincent, and our Secretary is April Day. And not to forget, the most important people in our leadership team are Chief Residents, Dr. Aviva Whelan and Dr. Marie Chevenon. I trained here myself. I graduated from this program 12 years ago. One of the things that attracted me to this program was the warm collegiality and the camaraderie between the residents.
I chose to come to Peoria because of the excellent training program in the Pediatric Residency that I was able to receive here. So just like any medical student, I was looking for the best residency program for myself. And I wanted to have an abundant opportunities in leadership and research. I wanted to have a lot of doors open to me for advocacy, for community service. I wanted to be able to feel comfortable after my training going and getting a job or going right into a competitive fellowship.
I think what's unique for our program here in Peoria is the people that we attract, both the faculty as well as the residents. You'll be welcomed into a really collegial program where, probably by the end of the first couple of months, you'll have every attending cell phone number in your cell phone.
One of the things that I really loved about Peoria and choosing to come here are all the people that I've met and the relationships that I've made. I think as a resident, you want to work with good coworkers, but more than that, you want to have excellent friends. And I've been able to make that here as a resident. You want excellent attending physicians, and in addition to attending physicians, you want to have mentors. I've been able to have an extensive amount of mentors in my training.
We do a lot of fun things to kind of get to know each other, including, an intern welcome party, to kind of get things started. We pretty early in an intern's year get them set up with a mentor that will be their mentor for, throughout their residency. And we align their interests with that person's interest. And so, I think we really try to forge that relationship.
My fondest memories as a resident are just having people at your home and just sharing your heartfelt experiences and having that time as resident to resident, as a doctor to doctor, to talk about the experiences you've gone through as a physician caring for patients and some of the hard things and some of the really rewarding things that we deal with every day.
Wellness is a huge priority in our residency program. As a program, we are really close-knit, and residents are free to come and bring up their concerns to our chief residents, or to myself, or to one of the associate program directors, or one of the assistant program directors. Our doors are always open to our residents. As a resident, there are several benefits to training here. We have a very close-knit faculty base as well. We have access to over 130 subspecialists and over 40 subspecialties here.
People that are looking for a moderate-sized program want to be able to have an individualized education and, want to be familiar. I think it's appealing in comparison to a large program because you don't get lost in the crowd. There's always someone to turn to. There's always opportunities. You get to know people well, be able to do research with them. And so I think those are some of the key things, in choosing a moderate size program compared to a very large, program. We have the same academic rigor. We have the same patient exposures. And so I think it's really, that comfort level of getting to personally know people and not get lost in the crowd.
We have a lot of resident benefits. There's free food, free parking. Our residents get an educational allowance of $1,200 per year, and this rolls over. So if you choose to pay for Step 3 in your second year, or if you choose to pay for your boards in your third year, you can use the money for that. Our residents also sometimes use it for electronics and things like that.
You will have a very rigorous education at a large children's hospital. We have a broad range of patient pathology, and one of the unique things is that because we are situated as one of the only children's hospitals in the area, we have a really broad catchment area, and so you will get a large view of different types of pathology and different types of patients during your medical training here.
So day to day at the Children's Hospital of Illinois, I usually get up around 6 o'clock. I get ready and get to work before 7. At 7, you meet your team that you're working with that day, depending on whether you are on the pediatric floors, the pediatric ICU, the neonatal ICU, the emergency department, in an outpatient setting, the newborn nursery. You have that large variety of service areas in one building, which is very convenient. And you meet your team for the day, you prepare to see your patients, and then you work together as a team to round and take care of all those patients. As an intern, you have the opportunity to really learn and have an approachable and safe space to be vulnerable and learn as a trainee and to get guidance and teaching from both your senior residents and as an attending. As a senior resident, you get that autonomy to teach both medical students and interns and guide them in taking care of patients, albeit whatever severity of illness they have. Typically, our day will end around 4 or 5 p.m. Of course, as a resident, you have days that you're staying on 24-hour shifts or longer with that extra care.
Our residents' outpatient experience consists of 2 different types of outpatient experiences. The ACGME requirements are to have 1 half-day clinic per week, but we actually provide 2 half-day clinics per week, enabling our residents to experience both the resident clinic as well as more of a private practice type of experience.
For research, I think that's a highlight of our program as well. Every resident is involved in a research project during their residency program here that is well supported by the residency program and our assistant program director, Dr. Christensen, who oversees the projects. We have a graduated educational curriculum in that, so you don't have to have any experience in research before coming here. The background is laid in a series of educational noon conference sessions, and then it's a really guided experience. So it should not seem daunting at all. Residents have done anything from novel research like coagulation studies in rats to advocacy projects in the community on food insecurity or healthy eating and active play, which I think is a really awesome thing. You can also do quality improvement, which you'll be involved in kind of throughout your education program here.
We have multiple global health opportunities. We have a rotation with Haiti. We've had residents that have gone to Nicaragua, Kenya, India, and multiple other places. At the moment, due to the pandemic, those rotations are on hold, but there is a global health elective that you can take that provides a lot of education in terms of global health.
We have a really robust simulation curriculum where you'll be going to a simulation session each month within our JUMP Center to practice, both emergency response and code skills. We also try to incorporate procedural skills into the monthly switch days for the floors, NICU and PICU, to incorporate things that you'll be doing, throughout the month, like bladder catheter placement or central line placement, or neonatal resuscitation, so that you can always keep your skills very sharp on those procedural skills. We have in situ simulations that occur on the pediatric floors to incorporate our nurses and our PERT teams, so that we, always stay at the top of our clinical acumen for response to patient care events. We also are developing, I think, a really fun procedural skills course that, or rotation that residents can take during their residency program here.
The pathology, the breadth and depth is extensive, and our patient population is very diverse. So you really get trained to be a very strong pediatrician when you walk out of this program.
We have a dedicated board review curriculum led by Dr. Elizabeth Rose, and we have a 100% board pass rate for the last 3 years.
For me, the most rewarding part as a pediatrician and as a resident in training are having families come up to me in the hallway in the foyer of the hospital and shouting out my name and coming and saying thank you so much for the care that you gave to my child, and them to show pictures of me, them to invite me to follow them or have a piece of their life, sending Christmas cards, those kind of things. That is really rewarding as a doctor, to have that relationship beyond just someone that's treating their child, but as someone that has really emotionally connected with them as well. My wife and I were looking for something that was more family friendly, and Peoria has offered us that. It's been so nice not to have traffic, to have virtually no commute, to be able to bike to work, to have abundant recreational and family opportunities for both my wife and my 2-year-old daughter. It's been excellent to have all of the amenities of a mid-sized urban center, but also to have a large catchment area of rural area as well, and the ability to get out and go do lots of outdoor activities as well.
Peoria is truly a great place to train and also a great place to live. The commute is almost non-existent. You can get from one place, point A to point B, in 15 minutes or less. We also have the pumpkin capital of the world, Morton, which is really close by. I had never had pumpkin ice cream till I came here for residency. The thought of it made me a little not so sure about trying it, but it is amazing. You have to come here just for that.
Hi, I'm Aviva. I'm from New York.
From Ottawa, Canada.
From Windsor, Canada.
From Roanoke, Illinois.
From Markham, Ontario, Canada.
From British Columbia, Canada.
From Toronto, Canada.
I am from Shelby Township, Michigan.
Hi, I'm Jamie Libis from Edison, New Jersey.
I'm Amin from Vancouver, BC.
Hi, I'm Katie Justice. I'm a PGY2.
Hi, I'm Amy Christensen, and I'm originally from Los Angeles, California.
Hi, my name is Jessica, and this is my dog Charlie, and I'm from Hermann, Missouri.
I came to Peoria to do residency training, and Peoria was my first choice.
I'm so happy I picked Peoria for residency.
The unique benefit of doing my residency here in Peoria is that we get to experience the combination of living in a mid-sized city and learning in an academic hospital setting where we get to see a broad range of pathology.
It's a great place where you can come and join our department full of awesome physicians and excellent residents. The climate really is conducive to personalized learning and career development with a focus on making sure everyone has the best experience.
This is a wonderful mid-sized residency program where you can see every type of patient and yet have close supervision from your attendings who are always available to you.
I feel like I'm on a personal basis with all the faculty and couldn't have asked for a better group of residents to work with.
I think one of the most unique things about Peoria, being a medium-sized program, is the family feel that we have here.
It's a really great group where you can learn a lot, but everyone really works well together.
The big thing about starting residence here is that I've had a very supportive family so far.
It's a really tight-knit community.
I decided to come to Peoria after I did a sub-I here, and I really enjoyed how invested the attendings were with resident education.
There's lots of benefits to having a 24-hour open cafeteria. It's also nice having a little group of 10 people to call your family as you progress through these 3 years.
We went to Italy twice, once in intern year and once in second year to Florence and to Venice. That was really fun. We went to Milwaukee for a weekend. We went to St. Louis for another weekend. There's tons of opportunity to do fun things here and travel.
It is a collective support by faculty and trainees that has historically led to robust scholarly productivity and national recognition for the work that our residents have done.
Within my first 2 weeks of residency, I had already performed 2 LPs and 3 bone marrow biopsies, all because my attendings knew that I was really interested in PTMOP. So that alone, I think, speaks a lot about our program.
I came here as a resident because I knew I would come out of here becoming not only a great general pediatrician, but also because I would be able to manage some really complex cases without needing to transfer complexity out of our hospital at any moment.
We have specialized faculty that are able to give experience in cardiac cath, electrophysiology, adult conjoint cardiology, echocardiography, and fetal echocardiography.
So we got incredible training and we made lifelong friends, and I think that's what makes the Peoria Pediatric Residency program unique.
At UEComp, the faculty is really focused on both resident well-being as well as education to help you become the best person and physician that you can be.
Peoria is a wonderful place for training. I would call it a diamond in the rough, as we have a tremendous amount of pathology, but within the city themselves, we have a great amount of diversity.
You get a large variety of interesting cases, excellent training, and you get to live in an affordable, accessible city.
I grew up in the Peoria area, and this is a great place to live.
Peoria is a great place to achieve all of your career goals, work in a close-knit community, and chase bunny squirrels, and meet all of your neighbors.
I really encourage you to look into this program because there are so many wonderful benefits and you'll have a really great experience if you train here.